Today I'm going to discuss type 2 diabetes remission. I became curious about this topic as I developed gestational diabetes, and I thought that type 2 diabetes was my destiny, and it wasn't a destiny that I relished. So I've co-authored a systematic review about this topic, and I firstly want to thank my colleagues at the University of Nottingham, without whom this would not have been possible, and in particular Professor Amanda Avery, who's been amazingly supportive. And secondly, I just want to mention a caveat that the results of this review are for people with obesity. There are a group of people with a normal BMI who have a raised body fat percentage who develop type 2 diabetes, and that is termed normal weight obesity and something I'm contemplating at the moment. So the results of the review show that the rates for remission with energy restriction of type 2 diabetes was high. This is very important, okay? And the rates were highest at new diagnosis, so early on, before the pancreas is burnt out. And every year, the rates of remission went down, so there is some urgency to act here. A large number of people achieved remission when they lost 10% of body weight, and 10% of body weight loss is totally achievable. And some people may need to lose a little bit more, but for many people this was enough. And if you think, oh gosh, 10% sounds like a lot, just bear in mind that the baseline weight for Caucasians in the studies was around 100 kilos. And so they would need to lose at least 10 kilos. And for South Asians, the baseline weight was 72 to 84 kilos. So they'd need to lose 7 to 8 kilos. So these are totally achievable numbers. And I'm here to tell you that if this is something that you want to act on, I have the unshakable belief that you can do it. I'm all in, and I totally believe that you can do this. I believe that we can turn the tide on type 2 diabetes, and I want to create a pathway for anyone who wants to do this. Just to bear in mind, if you are on medication and embarking on a weight loss regime, please do consult with your doctor before starting. Your medications will likely need monitoring and adjusting as you go on your journey. And also that if you are further along into your diagnosis of type 2 diabetes, there are still loads of health benefits to be gained from a weight loss regime. So please do still make those changes. So the take-home messages from this video are: type 2 diabetes remission is possible. Early action is important if the aim is to save the pancreas, so we need to act early before the pancreas burns out. In people with obesity, they should aim to lose at least 10% of body weight. Please consult your doctor before you embark on a weight loss regime. And if you want to do this, I have the unshakable belief that you can. It's a slam dunk, you can do this. So if you want to read the paper, it's in the link below. It's written in accessible language, so please do read it. And if you want to join me on this journey, please follow me.